I'm Lygia Ricciardi with Carium, and I'm here at the Digital Health Summit at CES 2020 with Jane Sarasohn Kahn, a wonderful friend and also the person behind Think Health and the Health Populi blog, and also now a recently published author of a featured book here at CES, part of Gary Shapiro's book club. Do you want to tell us about it, Jane?
Yeah, so I wrote a book called Health Consuming, From Health Consumer to Health Citizen, about the health economics of the patient journey into becoming a payer, and how as a payer we're consumers whether we like it or not. But in healthcare, can we really be a consumer? And you and I and our tribe of social media folks have really debated that for years, and finally I decided, let's write a book about why people are consumers even when we don't want to wear that mantle, and the promise of digital health and universal health care and privacy to have full-on health citizenship that people who live in other wealthy countries enjoy, but we do not in the United States.
So do you feel that we're at a particular tipping point now, and if so, what are the different elements that are contributing to change?
Yeah, so tipping point is where we are. So the big economy, the macroeconomy in the US, we're spending almost 20% of the gross domestic product, $1 in $5 nationally, but it's the same amount in the household. If the median income in America is around $60,000, $62,000 a year, the average family is spending $12,000, $13,000 on healthcare. That's $1 in $5 on the kitchen table. So you're talking about your housing, your utilities, your food, and your health care as being huge amounts of spending. And that is why we're at this point where people say, heck, if I'm paying $1 in $5, what's the value exchange? What's the return on my investment in a high deductible health plan? And how the heck do I shop for care when there's no transparency? So people are demanding an Amazon-like experience because they know what good looks like through, say, Amazon or Nordstrom or a positive Walmart.com experience or any number of things. So people want that out of the healthcare system, and that is why we see at the CES health plans like Humana joining the Consumer Technology Association, because they are trying to up the health plan game in consumer experience and marrying data to that health insurance experience as well.
Excellent. And as an individual consumer, what are some things that I might be able to do now, today, to exercise my consumer powers?
So increasingly, we can use digital scales like the Withing scale, which I've used for almost 10 years.
Me too.
Before and since the Nokia acquisition and then divesting. And Penn Jillette, the famous magician, active here in Vegas, wrote a whole book on how he lost weight and monitored, himself with a Withing scale. He's a spokesman for them. I got no skin in the Withings game except to say it works if you listen to it. But there are all kinds of digital technologies here at CES people can use, their watches, other wearable techs, remote monitoring. But we should never forget that in addition to digital, there's also an analog world of food and education and clean water and a good job, because we call those the social determinants of health. And when we can marry those aspects of our life, they're very powerful influences on our health beyond health care. So when we're at a CES, we never want to forget the need that people have for broadband connectivity so that they can take advantage of these technologies. And for many people, broadband's too expensive. So we think about democratization of connection and the importance of that in an environment like this with shiny new things. And we can never forget the importance of education, food, water, and voting annually in elections to own our health and not just rent it.
I hear a lot of language about empowerment. Do you think, final question, at the base here, is there an opportunity for perhaps consumers and maybe even others in the health equation to take on more of a role than they have in the past, or a different role?
Yeah, and when I talk about health citizenship in the book, it has rights and responsibilities. So the right, I think, is for universal health care, for everyone in America to have access to health care, and to be covered by a comprehensive privacy law well beyond HIPAA that brings all of our personal information together the way Europeans enjoy under the GDPR. But at the same time, we have responsibilities, and that is to take care of ourselves better than we are doing. So say you're diagnosed as with pre-diabetes. There are things we can do with food and exercise and social support that don't even cost a lot of money, but when we take better care of ourselves, we're taking better care of each other based on the statistical reality of social connections, and that your network influences you, but you also influence your network, online and offline networks. So I believe in the power of positive networks and positive connections. I write about it in the book, in the chapter Zip Codes, Genetic Codes, Food and Health. But connections, and the research of Christakis and Fowler in the book Connected really speaks to the fact that if you quit binge drinking, or if you stop having unsafe sex, or if you address your weight issues, you will have an impact on those issues in your network, and even more impactfully, your networks. So even if you self-loathe and don't like yourself that much, there are probably people you care about and love. Do it for them. And then we start to look at health as a way to bring each other together. And I really do believe health is one area in the United States that can bring people together in that positive kind of a way.
Sounds good. Thank you so much, Jane.
Thanks,
and speaking
Lygia.
of networks, I have to say thank you for being a part of mine and a positive influence in my life.
Mutual and ditto.